Joining us now is Dr. Robert Murphy, a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Hey, good morning.
Let me ask you a question that I see frequently on my Facebook page, which is these vaccines have not been tested a very long time. They're nervous about giving it to their children for that very reason. What would you say to those people?
Well, COVID has not been around that long either, and it's a disaster. And the hospitals now have much younger people being admitted because the older people have had the vaccine, and so they're being protected. So it's always a trade-off, Larry, always. COVID is much worse. There's the long haul syndrome that everybody is aware of, and that younger people are in the hospital. This is what the trade-off is. And tens of thousands of people have been in these studies, and they continue to be followed and will be followed for at least 2 years. So it's safe.
I didn't mean to cut you off there. You're talking about young people. Young unvaccinated adults are now the part of the population that's really getting the virus, yes?
Right, exactly. That's who's spreading it because they're not vaccinated. So, next week, Pfizer is going to get approved for 12 to 15. Moderna is going to have approval from 12 to 17, probably by midsummer. So, that is really going to help, and that's really going to help going back to school. Can you imagine how many more activities people can do safely at schools and stuff if everybody is vaccinated? It really is going to be great. It's going to really open things up.
Can you talk about the risk of COVID as it relates to how you board an airplane?
Yeah, there was a very interesting, it's a study now. It's not really actual cases, more of a modeling experiment showing that the way that airlines typically board is they board the people in the back first. So you're not tripping over everybody, whatever, in the random approach. It turns out that actually potentially spreads more virus. It's because of the congestion that occurs in the aisle itself while people are putting the luggage in the rack and then stepping over people who are sitting in the aisle seat. So this study recommends that maybe they should consider seating people first who are on window seats. So they get in and then get out of the way, especially as the planes are filling up. It's just an interesting study.
All right, let's get to some viewer questions. This person says, my son is 12 and has a peanut allergy. Should we get the vaccine for him when he's allowed?
Oh, absolutely. Remember, peanut allergies have nothing to do with the allergies of the vaccines. They're made of something completely different. Now, that said, people with peanut allergies tend to have just more allergies in general. Make sure you bring the EpiPen, and I suggest your son get vaccinated at a hospital or medical clinic or a facility that has an ambulance handy. There hasn't been any trouble with the adults with peanut allergies, so that's a really good thing.
All right, next question. If venues and attractions require full vaccination to attend, what real proof do we have? People could easily counterfeit or sell the cards. Will there be an acceptable and timely way to ensure that they are authentic?
This is a really good question. It's a really important question that will get more important as these vaccine passports get developed. I just bought a ticket on American Airlines the other day, and they sent me an app to sign up for that you put your CDC card that you get when you get vaccinated and load it up so that they have all the information there. Of course, there's always going to be fraud. I mean, people make fake driver's licenses all the time and whatever, but I think this is really going to be an important step forward. There is a way to do it that can lessen the fraud significantly.
All right, I have a friend that is still scared to get the vaccine. Besides the CDC website, are there any other sources I can point her to so she can learn about how safe it is?
Yeah, you have to really be careful here because there's more bogus websites than real websites. But the CDC, the FDA, the Infectious Disease Society of America, IDSA, WHO, all those have very reputable websites with all the information. Plus, the major universities working in the field also have one. Northwestern has one called Covaxin. You can look there. I'm sure the University of Chicago has one. Hopkins has one, the University of Washington, and many, many other universities. So go to the legitimate websites for your information.
All right, if you have a question for Dr. Murphy, you can head to our Morning News Facebook page and post it there. We'll talk to him again tomorrow at this time. Thanks, Doctor.
Thanks, Doctor.
Thank you. Have a good day.
You